Tasks. In this next video, we will be looking at the following topics around tasks. Planning your workload. Physical tasks. Complex tasks. And repetitive tasks. Please feel free to pause this video at any point to take notes. Planning your workload. Starting any task without planning how best to do it will almost certainly increase the chances of error occurring. By applying the rule of P's, namely prior preparation prevents poor performance, we can help individuals and teams undertaking tasks reduce the incidence of error and help anticipate any untoward events that may occur. When planning for a task, consider asking yourself and team members the following questions. What exactly is the task that needs to be achieved, and is everyone aware of what is involved to complete the task? Do you have the correct personnel for the task? And if not, what plan do you have in place to overcome this? Do you have the correct equipment? Is it readily available and working correctly? And has it been recently checked or serviced? Has all applicable documentation been completed? And have you and team members familiarised yourself with applicable information and guidance? Do you or your team members have the skills and proficiency necessary to complete the task? Before beginning any task involving team members, it is good practice to pause and ensure all members of the team are clear regarding their roles and requirements to carry out the task. Team members should be encouraged to ask questions of clarification if needed and to speak up if they feel they do not have the proficiencies needed to complete the task. Physical tasks. Most tasks performed will require some degree of physical exertion. In some instances, this may be very minor and barely noticeable, particularly those tasks involving precision or fine motor control, such as a surgeon performing open heart surgery. On the other hand, other tasks may require much more physical strength and gross manipulation, such as manually moving an anaesthetised patient from their ward bed to the operating table to perform open heart surgery. In either instance, we rely on our musculoskeletal system to enable us to perform these tasks. Our physical fitness is important in ensuring we're in an optimal condition to perform tasks when required. Of course, there are many complications that can occur to our musculoskeletal system throughout our life, such as temporary or chronic injury, stiffness and deterioration of joints and muscles in older age. This can lead to our physical fitness becoming suboptimal. It is important to recognise our own physical limitations when performing tasks so that we do not put others at risk or increase the chances of error occurring by not being able to physically carry out the task correctly. Physical work over long periods of time will result in fatigue. This is not normally a problem if there is adequate rest and recovery time between work periods. It can, however, become a problem if the body is not allowed to recover properly, possibly leading to injury or illness. It is imperative, therefore, that people undertaking physical work are in allocated periods of rest or breaks between exertion to attempt to reduce the incidence of fatigue occurring. Missing a break in an effort to get the job done within a certain time frame can be counterproductive, as fatigue diminishes fine motor skills, perception and awareness, and compliance to standards. As a consequence, work is more likely to be slow or of a lower standard and to incur more errors and mistakes. Complex tasks. Complex tasks generally require a much higher level of cognition and thinking to be completed to a high standard. These tasks are often associated with greater risks and consequences if error occurs, so it is important that the person undertaking the task is in both a physically and mentally optimal position to perform the task. People undertaking complex tasks must not work outside their area of expertise and should be competent to carry out the task. Ideally, the person completing the task should be aware of their limitations or any factors which may affect their ability to carry out complex tasks. Factors such as tiredness, fatigue, or stress, or other events that are likely to affect the level of concentration of the person undertaking the complex task should all be considered, and if these factors are apparent, a decision should be made whether the task should be carried out by that person safely. Repetitive tasks. Repetitive tasks can be tedious and reduce the attentive manner towards that task. Most of the human factors research associated with repetitive tasks has been carried out in manufacturing environments, where workers carry out the same action many times in a minute. This is less likely to occur in some industries such as healthcare. However, we should still be aware that some tasks will carry a degree of monotony to them. The main danger with repetitive tasks is that people may become practiced at such tasks that they may become complacent. Complacency is also a danger, whereby staff may skip steps or fail to give due care and attention to steps in a procedure, especially if it is to check something which is rarely found to be wrong. Always be careful when carrying out repetitive tasks. Making assumptions along the lines of, "Oh, I've done that job dozens of times before," can occur even if the task has not been undertaken for some time. It's always advisable to be wary of changes to procedures, remembering that familiarity breeds contempt.